Welcome to the Benosto Alendronate Sodium Effervescent Tablet for Oral Solution instructional video. This video will cover how patient should take Benosto. To take Benosto, patient will need 4 ounces of plain water at room temperature. Patient should take Benosto exactly as prescribed. Benosto is taken 1 time each week. Choose the day of the week that best fits patient's schedule. Then patient should take Benosto on the same day every week. Benosto works only if patient takes it on an empty stomach. Patient should take Benosto after getting up for the day and 30 minutes before taking their first food, drink, or other medicine. Patient should take Benosto while they are sitting or standing. Patient should not swallow, chew, or suck on a Benosto tablet. Do not dissolve Benosto in mineral or flavored water, coffee, tea, soda, or juice. Patient must dissolve 1 Benosto effervescent tablet in plain water at room temperature before they take it. Important administration instructions. To prepare Benosto liquid medicine. Step 1. Place the Benosto tablet in about a half glass 4 ounces of plain water. The water should not be cold or hot and should be at room temperature. Step 2. Patient must wait at least 5 minutes after the bubbling effervescence stops for the Benosto tablet to completely dissolve in the water. Step 3. Patient should stir the liquid medicine for about 10 seconds. Step 4. Patient should drink all of the Benosto liquid medicine in the glass. After patient takes Benosto, they must wait at least 30 minutes before they lie down. Patient may sit, stand, or walk. Patient may do normal activities like reading. Patient must wait at least 30 minutes before they take their first food or drink, except for plain water. Patient must wait at least 30 minutes before taking other medicines, including antacids, calcium, and other supplements and vitamins. Patient must not lie down until after they eat their first food of the day. If the patient misses a dose of Benosto, they should not take it later in the day. Patient should take a missed dose on the next morning after they remember, and then return to their normal schedule. If the patient thinks they took more than their prescribed dose of Benosto, they should drink a full glass of milk and call their doctor right away.
Video for educational purposes only. For U.S. residents, actor portrayal. Visit www.benosto.com to see full prescribing information and medication guide. Or call Ascend Therapeutics US LLC at 1-877-204-1013. Please see important risk information, full prescribing information, and medication guide at www.benosto.com. Benosto important safety information. Indications. Benosto alendronate sodium, effervescent tablet for oral solution 70 milligrams, is a bisphosphonate indicated for treatment of osteoporosis in postmenopausal women. For the treatment of osteoporosis, alendronate sodium increases bone mass and reduces the incidence of fractures, including those of the hip and spine. Vertebral compression fractures. Treatment to increase bone mass in men with osteoporosis. Important limitation of use. The optimal duration of use has not been determined. The safety and effectiveness of Benosto for the treatment of osteoporosis are based on clinical data of 4 years duration. All patients on bisphosphonate therapy should have the need for continued therapy reevaluated on a periodic basis. Patients at low risk for fracture should be considered for drug discontinuation after 3 to 5 years of use. Patients who discontinue therapy should have their risk for fracture reevaluated periodically. Contraindications. Benosto is contraindicated in patients with the following conditions: abnormalities of the esophagus which delay emptying, e.g. stricture achalasia, inability to stand or sit upright for at least 30 minutes. Do not administer Benosto to patients at increased risk of aspiration. Hypocalcemia, hypersensitivity to any component of the product. Hypersensitivity reactions, including urticaria and angioedema, have been reported. Warnings and precautions. Upper gastrointestinal (GI) adverse reactions can occur. Instruct patients to take Benosto upon arising and to wait at least 30 minutes before eating or drinking anything. Patients should avoid lying down for at least 30 minutes after taking Benosto and until after they have eaten. Discontinue Benosto if new or worsening symptoms occur. Use caution when Benosto is given to patients with active upper GI problems, e.g. Barrett's esophagus, dysphagia, other esophageal disorders, gastritis, duodenitis, or ulcers. Seek medical attention if developed dysphagia, autonophagia, retrosternal pain, or new or worsening heartburn. Hypocalcemia can worsen and must be corrected prior to use. Instruct patients to take supplemental calcium and vitamin D if dietary intake is inadequate or at increased risk of insufficiency. Serum calcium and symptoms of hypocalcemia should be monitored during therapy with Benosto. Severe and occasionally incapacitating bone, joint, or muscle pain can occur. Discontinue use if severe symptoms develop. Osteonecrosis of the jaw, most commonly due to tooth extraction and/or local infection with delayed healing, has been reported. Discontinuing bisphosphonates prior to invasive dental procedures may decrease the risk. The management plan for each patient should be based on individual benefit and risk assessment. Atypical femur fractures, occurring with little or no trauma to the affected area, have been reported. Patients with new thigh or groin pain should be evaluated to rule out a femoral fracture. Renal impairment. Benosto is not recommended for patients with a creatinine clearance less than 35 milliliters per minute. Patients sensitive to high sodium intake. Each Benosto tablet contains 603 milligrams of sodium, equivalent to 1,532 milligrams of NaCl, sodium chloride. Use caution in patients who require sodium restriction. Adverse reactions. The most common adverse reactions, greater than or equal to 3%, are abdominal pain, acid regurgitation, constipation, diarrhea, flatulence, dyspepsia, musculoskeletal pain, and nausea. Use in specific populations. Pregnancy. Discontinue Benosto when pregnancy is recognized. Lactation. It is not known whether alendronate is present in human breast milk, affects human milk production, or has effects on the breastfed infant. Use caution when Benosto is administered to nursing women. Pediatric use. Benosto is not indicated for use in pediatric patients. Geriatric use. No overall differences in efficacy or safety were observed between these patients and younger patients, but greater sensitivity of some older individuals cannot be ruled out. Renal impairment. Benosto is not recommended for patients with a creatinine clearance less than 35 milliliters per minute. No dosage adjustment is necessary in patients with a creatinine clearance value between 35 to 60 milliliters per minute. Hepatic impairment. As there is evidence that alendronate is not metabolized or excreted in the bile, no dosage adjustment is necessary. Drug interactions. Calcium supplements, antacids, co-administration of Benosto with calcium, antacids, or oral medications containing multivalent cations interfere with absorption of Benosto. Instruct patients to wait at least 1/2 hour after taking Benosto before taking other oral medications. Aspirin. In clinical studies, the incidence of upper gastrointestinal (GI) adverse events were increased in patients taking daily doses of greater than 10 mg alendronate sodium and aspirin-containing products. Non-steroidal anti-inflammatory drugs, NSAIDs. Benosto may be administered to patients taking NSAIDs. However, since NSAID use is associated with GI irritation, caution should be used during concomitant use with Benosto. Levothyroxine. The bioavailability of alendronate was slightly decreased when co-administered with levothyroxine to healthy subjects. Thank you for watching this video.